Hey, this is Dr. Renee from Fostering Wellness. Today I want to address the idea that arthritis is not specifically age-related. We hear this all the time. People come into the office and they say, well, I have this going on and this going on, and I was told, well, you know, we took x-rays, you have some arthritis, and it's just going to kind of be how it is. Let's face it, you're getting older. Not the case. All right. Now, arthritis is caused by a trauma to a joint or an area, or abnormal motion. If we're talking about osteoarthritis, this is what's happening, okay? So the longer I have that uncared for, untreated, the longer that abnormal motion is present, then the more arthritis I will have. Arth means joint, and itis means inflammation. So if something's moving wrong, I'm gonna have more inflammation long term, and that can actually start to change the shape of the joint as my body starts to lay down calcium there. So that's how you get bone spurs, that's how you get the arthritis look, osteophytes, whatever you wanna call it, the bones changing shape, and that's not good. All right, so I want you to think with me for a minute in terms of a vehicle. If I have rust on my vehicle, where is it usually? Behind the tires, right? Where the car gets most of the wear and the tear, where it's kicking up rocks, where it's kicking up dirt. So look with me here for a second. Let's take a look at this. If we're looking at this vehicle here and we see this rust that's present on the vehicle, that's right behind the tire. That's where all of this kicks up and hits there. That's where the salt, the grime, the rocks repeatedly hit. If we come up above it, there's some more rust. Just a little bit. If we come up here to the side of it, there's a lot less going on. Now, if I take my key right now and I drag that along the side of this car, what's going to happen? That drag mark is going to rust before the rest of it. Now, regularly, if the vehicle is washed, if it's maintained, if it's oil undercoated, if we were to treat and take care of that key scrape right away, we wouldn't have the rust. But the longer it's been there, the more evidence I see of it, the more it can spread from one joint to the ones next to it. Now, what we see with people who come in the office is they might have a lot of arthritis or a little arthritis in one part of their spine, but not in others. So if it was age-related, why wouldn't all of it be degenerating at the same rate? My wrist, my elbow, my shoulder, right? They're all the same age, I'm pretty sure, right? So we have to think to ourselves, what caused that? How do we correct it as much as possible? So once the rust has formed, now it's like a rusty door hinge. The more I move it, the better it will move, and the less rust will keep forming in the future. So that's what we do. If you haven't started an arthritic or degenerative process, we try to keep that from happening by keeping the proper motion in the joints. If it's already begun, let's slow it down to a stop as much as possible and keep that proper motion in the joints. Anyway, I hope this has answered some questions for you. Just want to let you know, just because you get older doesn't mean you should fall apart. Hope you have a powerful day. Again, this is Dr. Renee from Fostering Wellness. We'll talk to you soon.